We were started in 2009 by John, Luke, and Nico. They were originally Solomon employees, and from there they wanted to create a footwear product that essentially helped take the load off of endurance running and other endurance activities by giving you a plush, light ride while you're running and to help with recovery later on. So essentially, they went up to the French Alps, and that's where they founded this on the left side, the photo. They founded this shoe, and that was the earlier renditions of HOKA. And from there, they basically took models, and they would run trials up and down the mountain trails, recording their findings, trying to find the best ratio of the fast, light cushion ride that we find in our HOKAs today. They finally found their perfect ratio. From there, they started HOKA, and later we were bought by Deckers in 2011, where we also partner with some other brands, Sanuk, Teva, UGG, and Koolaburra. And that makes up the HOKA family, essentially. Looking at the HOKA experience, we have pretty much 5 main pieces or talking points when we look at HOKA product. For HOKA product, what people know us for would be that HOKA cushioning, that marshmallow light cushioning that people know us for. They come in, they're looking at the Bondi and the Clifton as an example, where they get that very plush ride. It gives them enough cushioning for running, walking, and all other activities in their daily life. From there, we can look at how we mold the foam heel to toe, and that would be the Meta Rocker. From heel to toe, we position the shoe where it has a lip up in the back and the front, where it gives you this almost like rocker sole. From there, we can also look at the J-frame. So the J-frame technology is another piece that we put on a few of our models, not everyone, but a few of our models, and it's unique to HOKA. Its name pretty much says it all. It's shaped like a J. On the bottom of the midsole, or I guess attached to the midsole, there is a piece of denser foam, EVA, that's attached onto the bottom of the midsole, stretching from the outside heel all the way through the underneath the midsole, or sorry, the middle of the medial side of the arch. And that is for stability. It's for a denser posting to add on to our already inherent stable nature, giving you just a little bit more if you need it. ProFly is just it's a sort of different foam that we use where it combines 2 types of densities, where we take our marshmallow-like soft cushioning, combine it with a little bit of a firmer, springier toe-off, and get this mix of foam dual density material where we call ProFly, where you get that soft cushioning, but you also maximize a strong push-off momentum with the shoe. Lastly, we like to imagine this as like a bucket seat of a race car. I like to also see it as like a canoe or a kayak, where you get this 360 feel of support. Other models, other brands kind of have you sit more on the top of the platform. This instead, we have you sit inside the midsole to give you that 360 structure of support. We look at the Gaviota, the Bondi, the Clifton, and the Bondi SR for the glide category. So that's more of our main line, where it has our standard go-to models, including the Clifton and the Bondi. We jump over to Sky, which will be the Anacapa Low, and then also the Recovery being the Aura Glide. All these models have the seal of approval, plus more within our line. So pretty much to break it down, the APMA seal So APMA is the American Podiatric Medical Association. And you might know this, might not know this, but just to break down the importance, value of it, it helps basically give the healthcare workers or professionals an idea of what to look at in certain models, and of not just our shoes, but other brands as well. Basically telling them this is an approved footwear product that can help people in their day-to-day life, not fix, but help. And there's some other points here, like identifying the different points of the product that can be sold on, presenting it to the customer, why it's important, why it can help. It goes through a lot of trials and clinical processes to get that seal of approval, and the time that it takes is a very large, long amount of time where they have to just go through trials and trials until they can finally get that seal of approval. And that's pretty much it. And from there, I want to look into different questions and things that different healthcare workers can ask me and ask the company that we can answer here today. So it's open to everyone, even the staff.
So I do have a question, Brendan.
Yeah, go for it.
Some of the HOKA shoes that I found that the outer sole is too smooth. And can you comment on that? And patients, they comment about they tend to slide easily and they wear out quite quickly.
Mm-hmm. So you mean the outer sole being the tread?
The tread, like specifically like the Hupana.
Oh, okay. Yeah, so I wish I had all the examples with me in person to show you. But essentially, between our different models, we do have some that have a official, traditional tread on the bottom of the midsole, where it's that black rubber material that you'd see in other models. Some others, they have more of a reinforced rubber on the bottom, where it's not as grippy, but it's more of a smoother feel on the bottom. And I wouldn't say all models, I definitely haven't heard that where it's too smooth necessarily.
Oh, I mean, like threads wear out quickly.
Oh, wear out quickly. Yeah. I think definitely on the reinforced foam outer soles, they will definitely wear out quicker. So like looking at the Hupana, for example, where it's reinforced, but it doesn't have an extra layer of protection on the bottom. The extra layer being that black tread that we put on other models, like the Clifton and the Bondi. So yes, without that extra layer, it's not going to be as durable as some of our mainline models. But we also find that people are not going to be like doing a lot of activity other than walking, or maybe using that specific model as like an everyday shoe. So like if people started doing more intense stuff with it, all that extra exposure and activity is going to affect the midsole or outer sole a little bit more.
Can you suggest a similar brand, model that would be comparable to Hupana that has a more durable outer sole?
Yes. So in my opinion, and with what they carry, going from the Hupana, I would probably go to the Mach. Now it's going to still have that reinforced outer sole, but it's going to still carry most of the characteristics that you find in that specific shoe. But something that's going to last longer and be more versatile for their day-to-day life.
What's the name of that shoe again?
The Mach 4,
MAC.
M-A-C-H.
Okay. Thank you.
Yeah, you're welcome. And then let me stop sharing so I can see everyone's faces. Yeah, and I mean, I included, so in general, all the models that we have APMA seal of approval on models in Glide, recovery, and also our hiking product. So that's why I included the Anacapa, which is not a current shoe that's out right now, but will be in the next month or so, just with because it was delayed. So, you know, there's going to be options that they carry that's going to be for a larger activity, a larger variety of activity list. Basically, oh yeah, yep. Thank you. I guess I missed that. 1 second. Do you want me to go back to the screen, Emil, the PowerPoint?
Yeah, just to show.
Oh yeah, for sure.
The kind of breaking down the APMA, why those, even though they're all APMA accepted, and the main differences between them.
Yeah.
Yeah.
Sorry, I kind of flew right by that. Good that you brought that up. So looking at this list, oh, what was that? Sorry.
I said, thank Doug.
Yeah, thank you, Doug. So looking at this list right here, so I have it broken down in our different categories, how we kind of categorize our own shoes. So Glide, like I was saying earlier, more of the mainline models that carry that soft cushion, marshmallow-like cushioning, and the Gaviota, which has that J frame. So if we broke down the models right here in Glide, starting out with Glide, I'll look at the Bondi and the Clifton first. So those models pretty much go hand in hand with HOKA. They're basically our bread and butter. They carry that soft cushioning, the marshmallow-like cushioning, light, performance-driven, and gives you a very smooth ride. Now, the differences between them will be that the Bondi is going to have a lot more of that cushioning underneath your foot from heel to toe. We like to, or some people like to joke around and call it like a platform shoe, because basically you add a couple inches to your height once you throw it on. That's how much cushioning is underneath your foot. And it's going to basically give you a lot more cushion underneath the ball of the forefoot. Now, compared to the Clifton, it takes some of that cushion from the ball of the foot, the forefoot, away to make it a little bit more activity driven. So if someone is running, if someone is wants to walk faster, wants to do a little bit more dynamic activity, it makes it so you can get that full rocker motion without it feeling like there's basically a big clunky fat shoe on you. Now the Bondi is going to be more aligned with where people will come in asking for a medical reason, being that it has a lot more cushion. And you get a lot more inherent stability from that shoe compared to the Clifton. Now, if we took the Bondi and added that J-frame technology, that denser material onto the midsole, that's how we get pretty much the Gaviota. So the Gaviota is utilizing that J-frame technology, adding a more denser post to the shoe, but also utilizing all that cushion that's from the Bondi, but in this model specifically, the Gaviota. You're going to get a little bit of a wider base, a wider spread compared to the Bondi, where if someone needs that, not necessarily more cushion, but a little bit of a wider base underneath their foot, a wider last, this is going to be more of that direction while still getting that stability factor. Now, if we took the Bondi and we looked at the Bondi SR, so the Bondi SR from top to bottom, it is more of a frontline, well, it's frontline service worker, hospital worker. That's kind of like where it's aligned with, where it's going to give you all that cushioning from the Bondi with a slightly wider last. So if someone tries on the Bondi, it's not going to necessarily be the same in the Bondi SR, the same size, because on the upper, it's going to be a leather upper. So the fitting's going to be a little bit different, wider last, and a non-slip bottom. So the SR means slip resistant. And it's been, so the slip resistant tread on the bottom is there for people who are working all those types of jobs, if it's in restaurants, hospitals, delivery, if they're on hard floors all day, anything where there is a potential to slip, or if there's something on the ground they can slip on. So the tread has been, why it also has the APMA seal, it's been tested on blood, oil, and water liquids of all kinds. So it's going to help significantly compared to someone coming in and just getting a Bondi, getting the same kind of, or wanting that same kind of support. And I forgot to mention, the Bondi SR will be coming in a wide coming December. So definitely right now, a lot of people are asking for that wide just because it is that leather upper, even though it is a wider last. Now, if we look at Sky, as I mentioned earlier, this isn't the only model that has the APMA seal, but for Soul Perfection, this is the model that they're carrying. This is more of an everyday outdoor type of shoe, being a low. It has it cut below the ankle. There is also a mid option for a hiking boot activity, or a hiking more outdoor activity if you wanted it. Now the base of this is not going to be as wide as some of the Glide models, but it's going to have that HOKA cushioning through the midsole, utilize Vibram, more of an aggressive tread on the bottom where it has multi-directional lugs, and a cable lace system that goes through the upper to keep your foot nice and tight. With that little tongue on the back too, it's to help your foot slip in, hold there nice and snug around the ankle without it rubbing. Also has, it won't allow the cup of the heel to press into your heel. So it's there to keep you nice, snug, and protected. And as we look at to the recovery, so we have the Aura recovery slide and sandal. For the slide and sandal, they basically take the same findings, the same dimensions from the Glide product, specifically more like the Bondi, where it has all that cushioning, that stiffer platform, and they put it into an open-toed shoe for people who, you know, if depending on their medical issue, they can't wear a closed-toed shoe. It opens it up, still gives them that support, HOKA cushioning, that stiffness to allow them to walk outside, inside, on hard floor, still receiving all that support. And was there any other questions regarding that?
Let me chime in a little bit.
Yeah.
The old Glide has been a great product for my patients with plantar fasciitis. A couple questions I have is that,
yeah,
in general, what shoe would you recommend for patients that complain of pain in the metatarsal region?
In general, I should have mentioned this, with that rocker platform, mostly all of our product being about a 4 to 5 millimeter offset in the shoes, It has your foot a little bit more flat. So not like zero drop, but it still gives you some angle from heel to toe. My personal opinion for that answer would go straight to the Bondi, with also saying that like the Bondi SR as well. I think I should share this too from my experience, and why I wear HOKA is that as Bob mentioned in the introduction prior to recording, I ran cross country and track in college, and I still run now. And why I chose to start wearing HOKA is that I developed neuroma in both my feet, basically pain in the ball of the foot, and I just couldn't deal with it, couldn't wear anything really without feeling pain. So I started wearing the Bondi originally, and then another trail shoe to help with my running, and taking all that pressure, because it is that lower drop, off the ball of the foot or the forefoot really helped out, because it didn't have my foot at that angle where it's putting more additional pressure on the ball of my foot. So saying that, looking at the Bondi and the Bondi SR, because of it being a lower drop and stiffer and putting all that cushion towards the front of the foot, it's going to allow more support, more comfortable option for those people coming in and saying, you know, the ball of my foot hurts, fix it, you know, that kind of situation.
Next question is, Brendan. Hey man, I walk in here and my Achilles tendon just tight.
Yeah.
What shoes should I be getting?
So if we look at Achilles pain, if it's tight or just overuse, anything that's a little bit more structured towards the back heel, in my opinion, would be a better option. So maybe like the Gaviota would probably be, out of what we see here.
Of course.
Gaviota would probably be just a little bit of a better option leading that, just because it has that J frame. Now you'll also be getting that extra arch support, but I think because how it wraps around the ankle, it's really going to help stabilize that ankle a little bit more compared to the Clifton and the Bondi. Now, saying that, the Bondi would still be a good option, but I would be leaning more towards the Gaviota.
So when would you recommend patients to get the Clifton?
So the Clifton, as I was kind of mentioning earlier, the Clifton and Bondi kind of go hand in hand. They're going to still have that cushioning. Now the Bondi is going to be a little bit more stiff with that extra cushioning towards the front of the foot. The Clifton has a little less towards the front of the foot. So if someone was if you sent in someone to the store and they've been wearing the Bondi, I don't know, for the past year, because of an issue that they've been having, but they want to get a little bit more into running, walking every day, something like that, where they want to feel a little bit of a smoother, not a smoother ride, a lighter shoe underneath their foot. And you said, go for it. And they're not having any other issues. I would probably lean more towards the Clifton then, giving them still that cushioning. So it's not like changing the shoe drastically. It's not saying, hey, take away the shoes, you're all fits now, here's some sandals, just changing the platform drastically. It's like taking that similar midsole, but making it a little bit more athletic, I guess, more runnable, as we say.
So you think the Bondi SR is more runnable than the Bondi 7? Or are you saying that Bondi SR is less runnable?
The Bondi SR is more, and Jason, were you going to say something?
Well, if I could just add to what you said.
Yeah.
The question was, what would you recommend the Clifton for? I would say the Clifton fits narrower. And for people who feel like the Bondi is maybe too clunky, too chunky, the Clifton's just a little more sleek of a walk to it. So it comes down to almost foot shape. Similar conditions can go into either one, but the Clifton is just a little lighter. It fits narrower. So that would be something that would make it different. And then because the Bondi SR is slip resistant, it's not necessarily because it's slip resistant, but because it's leather, it's probably more of a walking shoe than a running shoe. For my, having dealt with customers and patients with it. So hopefully that helps answer the question as well as what you said.
That's perfect, Jason. Thank you for saying that. Yeah, so as we see the line right here, Gaviota, Bondi, and Clifton, they're all still technically running shoes. Nothing about them is saying, and I'm not saying this either, that none of these shoes are running shoes or one or the other. I'm just saying that based off what customers ask for, what they come in for, that's what they kind of align more with. Now, someone could still run in the Bondi. As Jason was saying as well, the Bondi SR, that's going to be more of their work shoe, more of a shoe utilized, as I just said, in the work field, or if they just need something that is more structured for their day-to-day life. If at home they're on hard floor, if outside they're just walking on concrete, if they just need, or if they felt like the Hupana was too slippery, as someone asked earlier, this is going to help with that slip issue right off the bat, or even going upstairs, because I know that comes up sometimes with elderly consumers wearing not just our shoes, but just shoes in general, going up or downstairs, it catching or slipping on the stair surfaces. With that slip resistant bottom, it should prevent that. So I hope that answered your question in great detail.
Thank you.
Yeah, you're welcome.
Can I ask another question? It seems like I'm the only one that asks questions today.
Well, we only have a few people, so don't feel bad about it.
I'm just trying to toss you some softballs here. We obviously we make a lot of orthotics, and we try to fit patients with the appropriate shoe gear.
Yeah.
At times when I ask patients to get some HOKA, and with the orthotics, they come back and say, "Man, this is just too much stuff in my arch. It's not very comfortable." So maybe Jason can chime in on this. As if you see a patient come in with a custom orthotics, how do you guide them to find a good fit in the HOKA line, I guess is what I'm trying to say.
Sure, yeah. So the first thing is try to look at the foot by itself, so we can see how much the orthotic itself is doing it. Because for example, the Gaviota has got that pronation support, and sometimes when you add that, even with the J frame being really stable in the heel, you combine it with an orthotic, sometimes it's too much.
Right.
The other thing too to look at is within certain shoes, like the Clifton is a little narrower fitting, so sometimes that can really shove it into someone's arch a bit more, a bit too much. So a Bondi or a Stinson, which isn't up here, but a Stinson, a little roomier fit allows that orthotic to lay more flat and maybe the foot to rest on it in a more natural way rather than being jammed into the arch. So that's what we kind of look for, is a combination of, is the shoe pronation support or the shoe stability too much with the orthotic? If so, then we kind of, I guess, calm the shoe down, make the shoe more neutral. And then of course, how is it holding everything onto the foot? Is the two main criteria. And I think a lot of that depends on foot shape. And your orthotics are pretty shoe friendly, so it's easier. But there are times where maybe we have to go to a really mellow shoe just because an orthotic is so crazy. I don't know if that, hopefully that answered the question.
Well, I get it. At the same time, though, sometimes people complain that the Bondi 7 is too mushy. So in that case, what would you recommend uh, instead of the Bondi? They say, God, this is like too marshmallowish, if that's the
Yeah.
right word.
Yes, yeah, I've definitely seen that because it is very soft. So lots of times I'll go to the Stinson, which is basically a trail running version of the Bondi. It's the way I describe it. Brandon can maybe describe it a little different. And because it has more of the grip pads on the bottom, it creates a different ride, a little more stable of a ride than the Bondi. Because yeah, we've had people who the Bondi is just too squishy. Cushion's good, but it's got to be stable. So the Stinson often works well. Or if they're, if the pronation level is okay, then that J frame of the Gaviota does work well. The Anacapa is a shoe that's coming out, but we have currently the Challenger and some other ones that are the hiking. And again, the hikers tend to be, because of the, I don't know if it's carbon rubber, but the grips on the bottom add just a little more stability compared to the Bondi. Because we've had that same issue where it's too soft. And so we try to take it to either the trail runners or maybe the J-frame platform. If that helps.
That's all I got, man.
Yeah, just to chime in and just add on to that. So Jason, yeah, you said it pretty well. If they didn't feel like all that extra support was an issue, my first say would go to Gaviota, just because it is going to be with that extra, that denser piece of foam on there. It's going to be a little bit firmer. Now, if we look at hiking, or not hiking, but like if the Anacapa or even their trail running options like the Stinson or Challenger, because of that tread on the bottom, it, as Jason was saying, it is going to create a different sensation underneath your foot, where it's going to add just another layer, where it's going to feel more rooted, or not rooted, but more firm to the ground with each contact. And with all of our products, it does come with a removable insole. So like, depending, I know how custom orthotics, that's why they're custom, all of them are different. So depending on the shape of the person's foot, low volume, high volume, depending on how their foot is, where it is, and what support they're getting from you, and then putting it in the shoe. Yeah, definitely looking at like the Bondi SR, but the wides, I wouldn't say, if they needed an insole, to not go with the normal sizing because it's going to be too cramped, but maybe the wides would be more prosperous. The Bondi, the Stinson for sure, because it is also our widest lasted shoe. So that just meaning that the platform underneath your foot is wider, is the widest out of everything else in our line, without going up a width size.
This is Paul Coulter. I was just wanting to, I do a lot of lacing pattern changes to the shoe to help people to get a better fit.
Yeah.
A lot of times patients come in and they don't have their shoe laced appropriately for their foot type.
Yeah.
That's, I like the fact that you guys use kind of a flatter lace. It sometimes is easier to get a better fit for a runner that's got a higher arch or is having like a little bit of neuropraxia on the top of their foot from nerve irritation, of the deep perineal.
Yeah.
And I like to mix and match a lot of times on my different lacing techniques to make sure that the patient's happy with the fit. Sometimes though, the shoes get changed. Like you guys go to like a Gilly lacing system. The Gilly lacing system, sometimes if it's interspersed, will be more difficult to give a better fit sometimes.
Yeah.
I can speak
Go
to
ahead.
that. since I hate Mr. Gilly. I'm first on the anti-Gilly
Go for it, Emil, if you
fan
want
club.
to.
So
jump on it.
that's a big been a big bugaboo for me and a lot of accounts on the Gaviota. And once it gets set, unfortunately, we can't do a lot about it. But the Gaviota is normally a 2-year shoe in terms of its life cycle, and we reduced it to 1 year actually to improve the upper. And one of the biggest changes we made was getting rid of the Gilly laces on the next Gaviota. And so that's the last shoe, and all the styles that are coming out in spring 22. I know it's still a few months out, but those start in December and January, and there won't be any more Gilly laces on any of the styles.
Yeah.
Thankfully.
Yeah, that's good.
And I mean, with pretty much all our models, I mean, whatever lacing style you do, from my experience, at least working also in the retail, like on the floor and in the retail side of things, using the product, most lacing styles work. If it's opening up mid, down, or down towards the toe to give a little extra room without going up to a width size, because sometimes that's too much for people. But also just, yeah. So is there like any way specifically that you usually do it, or did you have any questions around that either? Or yeah.
Well, I'm definitely glad to hear that you're getting rid of the Gilly, because it makes it so much harder to give a better fit when you have to kind of work around that.
Yeah.
I wish that they would look at adding, realizing that each foot style is different, and that the more eyelets that you can have, that, like I always try to explain to patients, you don't have to use every eyelet. You can lace the pattern around the foot and not worry about that you didn't use one eyelet or another eyelet here. And a lot of times patients, when you give them that better fit with the lace, they may have problems with the fit of the orthotic, but you do that and all of a sudden they're like, wow, that really feels a lot better.
Yeah, for sure. And I think just overall fit too, combined with if you're gonna lace it differently or just how it is right now. Anti-Gillies for sure, but with your foot being more kind of submerged into the midsole, with your foot just sitting inside the shoe, and with whatever way you lace it, I think whichever way you do it, it's gonna still feel comfortable heel to toe, or feel locked in either way you do it, in any scenario. So I know, like, I've done where you skip like the whole midsection, not the whole midsection, but the whole like more of the middle section, and people still feel secure just as lacing it up normally. So I think just having that extra, not extra room, but having your foot submerged in the shoe a little bit more helps you feel that wrapping feeling with whatever lacing style you're used to or need.
Yep. Yeah, I agree.
And then Jason, I think if no one else has any question, I think Jason had something.
Oh, I was wondering, I can go, the very first question was about the durability of the bottom of the shoes. I can go grab a pair of shoes. I don't have the Hupanas left, but just to show, like, whatever, I call it carbon rubber, the more durable tread bottom, because especially in the earlier editions of HOKA, some of them did wear out faster, but I feel like that's been improved. But the Hupanas definitely don't have much of an outsole. I can do that if that helps. If anybody wants to see that, I can show the difference.
Yeah. Yeah, I think that would help them and whoever watches this later on too.
I'm going to go grab some examples.
Yeah. So, and I know definitely compared to older product, we've made a lot of improvements from the outer sole to the upper. So depending on how old the shoe is that the customer or the patient comes in with and they're having slipping on it, that might be why. They might have an older model. It might just be really worn out. It might just be the Hupana. Who knows? You know. But yeah,
Okay.
go ahead, Jason.
So I have the Casa, which has the same bottom as the Hupana. And what you can see is the midsole material. It just goes, it is the outsole. So you compare this to, say, just the regular Bondi with these more durable sections. And this, if you know, just believe me, it's more durable. It's a tougher rubber, which protects the softer rubber. So that'll definitely be longer lasting. And then you compare that to, say, like a trail runner. This is the Stinson. And these are not only the more durable rubber, but they are thicker and grippier. And so from a durability standpoint, they're definitely, like, I would say they're regular shoes, the Glide series. I'm not sure what the Akasa or the Bondi, or no, the Akasa or the Hupana are in. You have to help me with that. But I'd have to say their regular shoes or their hiker shoes are far more durable. And in fact, the Stinson, I hike in these.
Yeah.
They're super grippy. I've done snow. So they're great. I've even did Mount St. Helens in them. So they're really good. So anyways, that should help answer some of the durability issues, I hope.
Yeah. And then I have a pair of mocks that I can show. I just realized I have some clean pairs. I won't use my own. That has a fresh surface on the bottom that you could see and compare. If you want to keep up that Hupana, or you have the Akasa. Sorry, Jason. Yeah, one moment.
Also, it's good. I don't know if Brendan mentioned, but the Hupana has been discontinued. So it is no longer going forward. And the closest replacement currently would be the mock.
Yeah.
Yeah.
So just an example, here's one of the colors, the Mach 4. And on the bottom, I might have to stop sharing my, or not sharing, but get my background off for you to see, because that is a nuisance. There we go. So underneath, you can see that it does have a similar platform to what the Casa has, but this is based off years of improvement from that shoe to this shoe. Plus, when I was saying that it's reinforced, the pattern doesn't mean anything, but the whole bottom of this sole, at the bottom of it, to replace that sensation that you would get with a tread, it's reinforced on the bottom of that compared to the rest of the sole here. Through the sole, we use the two types of foam here on the bottom to give you that firmer, more durable ride while utilizing more of the cushion here. And that's kind of like how we do it now with more shoes that kind of align in that category. The Mach, well, from the Akasa and Hupana to the Mach now. And they're more like within our fly category, because they're lighter, not as built up as like the Clifton and the Bondi. Doesn't mean they're not as, you can't like utilize them for different activities. They still have that HOKA cushioning, that active foot frame, the rocker, all that. It's just the differences between the treads and as like the Stinson that Jason showed. All those differences between the tread, it really depends on what they're looking for, what they need, you know, all that too, because definitely stiffer midsoles compared to a more flexible midsole, wider platforms compared to a more narrower fit. All those things are taken in consideration when looking at different models, especially within our line.
We do appreciate the relationships that we have with all of the doctors and you guys in particular. And we're looking forward to a vastly improved 2021, and then certainly a super 2022. And as everybody starts getting vaccinated and feels safer to come out, then our business is going to improve. And I think the flow of patients to the doctors will improve as well. So, but thank you guys. We appreciate it. And hopefully it was beneficial and that you learned more about HOKA. It's one of our top selling brands in our store. We started with HOKA, I don't know, Emil, it was 5-6 years ago, back with Mike Stevens, and it's been one of our fastest growing vendors. And I think you guys set all records with us, and I know you're setting records out there in the running world. Congratulations to the HOKA guys.
Yeah, thanks for your great support from retail to on the retail side and medical side too, docs.
Yeah, I just want to say, if anybody watching this has any more questions that we didn't address here, feel free to reach out to us at our store, or me, or whatever, any of us at the Soul Perfection stores, and we're happy to answer any more questions. Or if we can't answer it, we will get you in touch with the HOKA people.
Sweet. Thanks, Jason.
Thanks again, everybody. Stay safe.